The Health Equity Collaborative for us started in December 2022 when the Institute for Health Equity and Barnardo's put out an expression of interest for ICBs to join them, thinking about how do we understand the key drivers of health inequality for children and young people. So as an ICB, we applied for that expression of interest, and that was a collaborative bid across public health, our directors of children's services colleagues, and beyond as the Children's Transformation Programme. And we were really keen to ensure that we were alongside the programme of work, because a lot of our work is around wider determinants of health inequalities and making sure children in Cheshire and Merseyside get the best start in life. So we went through an application process and were successful, along with two other ICBs that are South Yorkshire and Birmingham and Solihull. And so started to work as a collective, probably in March last year, we really got started thinking about what do we understand from the data around the wider determinants for children and young people, about what are the impacts on children's later health and outcomes. So what does the data and the research show us? And the Institute for Health Equity were really keen to look at that. What were the key data points that we needed to think about? But most importantly, what did children and young people tell us about what mattered to them during their childhood and early adulthood? And what did they think were the key issues that affected them as they go through their development? And the collaborative has employed 10 children's health equity collaboratives, and we have 4 in Cheshire and Merseyside. We have Nell, Erin, Emily and Bella, who are working with us as a collective, and their voices have been central to the development of this framework. The collaborative also went out to a broader group of children and young people, so we talked to over 300 children and young people about what mattered to them. And they were able to tell us that there's lots of interesting stuff from the research, but that doesn't necessarily reflect what are the key issues for them as young people. So, as mentioned before, children and young people have been absolutely instrumental in helping us think about what that framework should look like. And what they've said is that there are issues around safety, personal safety, and particularly around psychological and physical safety. Actually, they don't really distinguish between the two. They're really clear that we need to think about that for them. They pulled out family, and that isn't just biological family. They talked about community and how you feel safe and loved within community. Love was a really strong issue that came out for them, and we don't measure that typically. They talked about the importance of education as a place where they can thrive, but that they need trusted adults in those educational settings, and education can be good or bad for them depending on their experiences. But the importance of education in inspiring young people to have appropriate futures and to achieve the very best that they can, and home. And they talked at home, as I said, around kind of family, psychological safety, but also in relation to the physical environment. And within that, there was conversations with them about the cost of living and how they manage in relation to some of those issues. So the framework obviously starts in, and there'll be a slide that explains this in more detail, but we talk about social economic issues. So what is the political landscape? How does that influence the national and the local picture? So what are those drivers? But then it looks at social position, living conditions, and kind of the intersectionality of personal characteristics as well, and how all of those things combine to result in children's health and well-being. And the point of the framework is to really get us to think about how can we work upstream, how can we work in that early intervention prevention space to make a real difference to the lives of children and young people, and challenges us as a system to really think about how can we do things differently collectively to make sure that children are getting the best start in life. So as mentioned before, children's voices have been absolutely central to how we've developed this. And I would say that the framework has changed quite significantly from the first iteration of it into the final framework as a result of those voices. I think the challenge is, as a result of that, is that the data points that are routinely collected are not always the data points that matter to children and young people. So one of the conversations we've had throughout the whole of the collaborative is the green spaces that are local to children and young people. They might be just down the road, but if they're not safe for those young people to access, then they might as well not be there. So actually it's about safety rather than geographical access. So how do we measure that? How do we think about that? So the young people's voices have already been absolutely instrumental to the development of that. But what I would say is those insights for us in Cheshire and Merseyside have been used in a range of other different settings as well. So we've been able to broaden the influence. Our Children's Health Equity Collaboratives champions have been and spoken to the Children's Committee around what matters to them and given a real challenge to the committee about how do we make sure that our policies and our developments reflect their needs. They're coming to talk to the Beyond board. Those insights are shared in all sorts of means across the ICS. So I think the influence is within the framework, but also about how do we make those voices known elsewhere. So one of the real opportunities, I think, and this has been throughout the collaborative, is the work across the system. So the continued work across public health, social care, the third sector, about how do we really consider what matters to children and young people. There has been a huge work as part of the collaborative on data insights. And how do we make sure that we've got maximised data sets across all settings? Because typically we've been able to look at health or social care, but how do we make sure that we're looking at the richness of data available across all sites? I think that influences risk stratification, helps us make sure we're focusing our efforts in the areas where we'll make the most difference with the highest levels of deprivation and other intersectionality. I think the opportunity to listening to the voices of children and young people has come out really strongly, and we need to continue to build on that. And then the next step of the collaborative is to use the data insights and the voices of children and young people to think about where can we intervene. So how can we take the framework, look at where strategically we can make decisions that impact on later outcomes. And I think that's the future opportunity, is how we use that framework to understand our population better and then influence our commissioning decisions and our service delivery to really get upstream to make a difference and ensure that children do get that best start in life.